So personally, for me, I would say that challenges are part of our day-to-day life, and there's certainly so many that I can list. But the ones that come to mind, or the ones that probably were the most difficult ones, must honestly be just personal hurdles. I would say imposter syndrome, sometimes anxiety, and wanting to know and do and learn everything at the same time, and being frustrated when it's obviously not possible for you to know and learn everything all at once. And in hindsight, honestly, it's just taking time, trusting the process, that everything eventually will make sense. I will eventually get to know and do everything, and I'm still learning doesn't stop. It's a continuous process. I'm still in that process right now. And as well, asking for help. You're not alone in this situation. There's other people who are probably feeling the same as me, and just asking from help from a fellow colleague, resident, same class as me, or a senior resident, or a consultant, or a friend, anyone who would have any type of insight will be able to help, and that will at least make the challenge a bit easier to handle. So I mean, my experience has been in, number one, back home in Kenya, in both the private and public sector. I did spend a few months in New Delhi, India, which is also a private hospital, but in a population, or in a country that has a very big population, and that, of course, affects its medical service delivery. And then currently doing my fellowship in Halifax, Nova Scotia, Canada. And I would say this is not necessarily a problem that is specific to the Western world only, but definitely cost. Cost is a big problem, and not just financial, actual money cost, but time cost. Because as much as, for example, in Canada, healthcare is a free-for-all service, and you don't necessarily have to pay for it. There's a time aspect of waiting, and the waitlist problem is something that is known universally, and that's not necessarily, as I said, not just a problem here in the Western world, but it's everywhere. One of the things I always try and tell my friends and family is that there's no one who can actually afford their own healthcare, regardless of how much income you make. It's one of those things that sometimes you are, as a service provider, are not able to even afford the healthcare that you're giving if you don't have maybe a certain insurance plan, or if you're not in a place where the system is able to cover it. The other thing that I probably would say that is unique to the Western side of the world that I've experienced so far in the short amount of time I've been here is probably a bit of wastage and some items that could potentially be, sterilized and reused tend to not be, and also just time management, turnaround time and everything. But I mean, some of these are not only unique to the Western world; it's sort of everywhere. And there's actually no perfect. I should have probably prefaced this answer by saying there's no perfect healthcare system anywhere. Everywhere has its pros and cons, and I think as a service provider, you just have to make it work, be able to provide the service well, and of course be compensated well enough. And also for the patients, need to be comfortable, access it, have access to it, good quality, effective, so that the outcomes are good. So that's what I would say about that. That's an interesting question, Sina, because I would say there's a challenge every single day in every single case. But probably my first solo case as a resident. So where I did my residency is a pretty resident-driven, training program with quite a lot of independence, which certainly has a lot of pros. And it happened to be a week. What happened that year in the OR as a junior resident, I was, I think, in my second or just beginning my third year, and I had been in the OR with a fifth-year resident all week, and it was a Friday. We had been confidently operating together as his first assist, and on this Friday morning, first case on the list was a lateral a tibial plateau fracture. I can remember lateral split scat scar 1, and the senior resident happened to be running late and he wasn't able to come in on time. And so you're now the lead or the most senior in the room. And well, I remember being at a point of deciding, so am I gonna delay the list and wait for him to come, cancel the list because I don't feel like I may be confident enough to do it, or what happens? And I remember, you're basically at the point where you have to make the decision now. And I took it on and I went ahead and took charge of the list. You've assisted in a couple of them, but until you're the lead surgeon doing it from start to finish, that was honestly a changing moment for me. And how it changed me is that when I actually realized you are the surgeon, you are not just the assistant. And even as much as you may be assisting in surgery, you are not just you're not just an assistant, you are the surgeon. This is your time, it is you doing this, and you are able to do it and you can do it well. Certainly gave me the confidence and just that push that you needed now to move on, and I've never looked back since then. And one of the other great lessons that I learned is teamwork makes the dream work, because we had some I remember quite experienced scrub tech and scrub nurse, and the implant technician who, all together, step by step, we made it through, and everyone in the room was helping to, navigate through the case, and it went well, and actually continued on with the list. By the time the senior reg came in, we were, pretty well on, and I would say that was one of the big challenges, and how I was able to overcome it. I would still remember that up to now, a few years later. That's a pretty simple one. I love spending time with my family and friends. I have a big family, group of friends back home. And when I mean big family, also very close. We literally love spending time together. Any small inconvenience, like a 1-year-old birthday or someone started walking, we'll meet for lunch somewhere and be together. So weekends would always be at someone's house. There's food involved, some music, everyone running, all little kids to adults, everyone of all age groups running around, having discussion, maybe some dancing. And when I moved here to Canada, certainly one of the most difficult things I had to deal with was being away from my family. But I have then created my own family here, and friends that I do spend the weekends with. Monday to Friday tends to be so stressful and intense. I like to decompress by just being with people and having conversations, eating some good food, listening to some good music, dancing a little bit, and sharing. That's what sets my soul on fire and fills my cup up back for the week. So certainly it just remained the same when I moved over here. Wow. So I must say, well, like, classically, the Harry Potter series. What was my one series that I nerded out on growing up. All the books, the movies. I probably watched the whole movie set once a year, even up to now. But maybe more recently, been working a lot on personal development and personal growth. And two books I've read this year have stood out. That's Will, the book by Will Smith, his personal memoir and his story, and also Mark Manson's The Subtle Art of Not Giving an FUCK. One of the books that just helps you look inside, self-discovery, self-mastery. Also, sometimes it's not really all about you. It's actually get out of your head, move around more. That has really helped me just navigate moving to a new country, figuring out a new system, life, and just being comfortable and happy with myself every day. So those are some of the books that I've enjoyed to read this year particularly.